Pulmonary circulation is the part of the cardiovascular system responsible for carrying deoxygenated blood from the right side of the heart to the lungs and returning oxygenated blood back to the left side of the heart. Here's a step-by-step breakdown of the process. Step-by-step process of pulmonary circulation. 1. Deoxygenated blood enters the right atrium. Blood returning from the body via the superior and inferior vena cava collects in the right atrium of the heart. Number 2. Blood flows into the right ventricle. The right atrium contracts, pushing blood through the tricuspid valve into the right ventricle. 3. Right ventricle pumps blood into the pulmonary artery. When the right ventricle contracts, it pushes blood through the pulmonary valve into the pulmonary trunk, which divides into the left and right pulmonary arteries. 4. Blood travels to the lungs via pulmonary arteries. The pulmonary arteries carry deoxygenated blood, unlike other arteries, to each lung. 5. Gas exchange in the lungs. In the alveoli of the lungs, carbon dioxide, CO2, is exchanged for oxygen, O2, across the thin alveolar capillary membrane. 6. Oxygenated blood returns to the heart. The newly oxygenated blood travels from the lungs back to the heart via pulmonary veins. Unlike other veins, these carry oxygen-rich blood. 7. Blood enters the left atrium. Pulmonary veins empty into the left atrium of the heart. 8. Blood is sent to systemic circulation. From the left atrium, blood flows through the mitral bicuspid valve into the left ventricle, which then pumps it into the aorta for distribution to the rest of the body. Here are the functional features of pulmonary circulation, highlighting how it supports respiratory and cardiovascular efficiency. Functional features of pulmonary circulation. 1. Gas exchange. Primary function, exchange of gases, oxygen and carbon dioxide between the blood and the alveoli in the lungs. Oxygenation, blood picks up O2 and releases CO2. 2. Low pressure system. Pulmonary circulation operates under lower pressure compared to systemic circulation to prevent damage to the delicate lung tissues and to promote efficient gas exchange. 3. Short pathway. The pulmonary circuit is relatively short, heart, lungs, heart, which helps minimize time for gas exchange and maintains optimal pressure. 4. High blood flow volume. Although pressure is low, the pulmonary circuit handles the entire cardiac output, 5 to 6 lmin, ensuring continuous and adequate gas exchange. 5. Elasticity of pulmonary vessels. Pulmonary arteries and arterioles are more compliant, elastic, allowing them to accommodate changes in blood volume without major pressure fluctuations. 6. Blood filtration. Pulmonary circulation also filters small clots, air bubbles, and debris from venous blood before it reaches systemic circulation. Number 7. Matching ventilation and perfusion. It maintains a balance between airflow, ventilation, and blood flow, perfusion, to different areas of the lungs, ensuring efficient gas exchange. 8. Reservoir function. Pulmonary vessels can act as a blood reservoir, accommodating extra blood during systemic needs, e.g. during exercise or hemorrhage. 9. Metabolic function. The lungs contribute to the metabolism of vasoactive substances, such as converting angiotensin 1 to angiotensin 2 via angiotensin-converting enzyme ACE, present in pulmonary endothelial cells. Application of pulmonary circulation in nursing. 1. Patient assessment. Respiratory assessment. Nurses assess breath sounds, respiratory rate, oxygen saturation, SpO2, and skin color, detect abnormalities in gas exchange. Cardiovascular assessment. Monitor heart rate, blood pressure, and jugular venous distension, which may indicate right heart strain from pulmonary issues. 2. Oxygenation monitoring. Understanding pulmonary circulation helps nurses interpret pulse oximetry and arterial blood gases, ABGs. PaO2 or SpO2 may indicate poor pulmonary perfusion or gas exchange. PaCO2 may reflect hypoventilation or impaired diffusion. 3. Early recognition of complications. Recognizing signs of pulmonary embolism, pulmonary hypertension, or acute respiratory distress syndrome, ARDS, is critical. Symptoms: sudden shortness of breath, chest pain, cyanosis, restlessness. Timely reporting and action can be life-saving. 4. Positioning and mobility. Nurses use positioning techniques, e.g. semi-Fowlers, turning schedules, to promote optimal lung expansion and ventilation perfusion, VQ matching. Early ambulation post-surgery helps prevent venous stasis and pulmonary embolism. 5. Oxygen therapy and respiratory support. Nurses are responsible for the administration, monitoring, and titration of oxygen therapy, depending on the patient's need. Support mechanical ventilation in critically ill patients, and monitor for complications affecting pulmonary circulation. 6. Medication administration. Administer anticoagulants in patients at risk of thromboembolism. Use vasodilators, e.g., for pulmonary hypertension, and understand their impact on pulmonary circulation. 7. Health education. Teach patients about smoking cessation to reduce pulmonary vascular resistance. The importance of deep breathing and coughing exercises, e.g., incentive spirometry, to improve ventilation. Recognizing signs of respiratory distress. 8. Monitoring fluid balance. Excess fluid can cause pulmonary edema, while dehydration may impair perfusion. Nurses monitor intake output and assess for signs of fluid imbalance. Thank you. Have a nice day.